talk about an alarming way to wake up. Today's patient went to bed with leg pain and woke up to find his leg had doubled in size. Learn the life-saving treatment along with the procedure that had him back on his feet on today's All Things Heart.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday, I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. I'm Alexis Del Cid. Welcome back to All Things Heart. This is what our patient Steve saw when he woke up one September morning last year. His leg had doubled in size. We will explain the life-threatening cause of that swelling and take you along for the procedure to treat it.
Here comes those warm blankets for you.
Steve is not going to remember any of this conversation. He's in a twilight state as his medical team works to reach the site of a large blood clot in his leg.
It was pretty extensive. It probably went from my knee up to at least my hip. So, a foot at least, maybe 18 inches.
When we met him in pre-op, he talked about that day in September of 2023 that he noticed an ache in his leg.
I had some swelling in my left leg, discoloration, and then some pain as well.
The next morning, Steve says he woke up to a jarring sight.
How swollen was your left leg?
I'd say about doubled in size. So mostly in my thigh to start, and then above the knee was mostly where the swelling was, and then it sort of migrated down through into my calf and into my foot.
He went to the emergency department and was immediately placed on a blood thinner. He then saw a hematologist who referred him to Dr. Adam Alley, a vascular interventional radiologist at the University of Kansas Health System.
I didn't really know much about blood clots until I started researching it and found out that it can be pretty severe if not treated quickly.
The treatment itself can be tricky. In Steve's case, the clot developed in a vein that's getting pinched by an artery sitting on top of it. Dr. Alley and his team need to figure out if it's best to remove the clot or safer to reconstruct the vein that's collapsed. What this team decides over the next few hours will be a conversation for when Steve is fully awake in post-op.
We are so pleased to have Steve joining us virtually today, along with his vascular interventional radiologist, Dr. Adam Alley. Thank you for taking time to be here. Steve, I want to get to you. First of all, is your leg back to its normal size now?
Yeah, thanks, Alexis, for having me. It's doing much better. I've been doing some regular follow-ups with Dr. Ali and my hematologist, and I'm happy to report that, yeah, my leg is pretty much back to normal at this point, which is great.
So you were awake for the whole procedure in kind of a twilight state. What do you remember about the procedure?
Yeah, you're not fully knocked out, if you will. You're kind of in the twilight zone. So I remember some of the nurses being around me and kind of walking me through what's about to happen as they're prepping me for each stage of the procedure. You're fully conscious, but you're sort of present but not present. So
right.
A couple of times they'd want to roll me over or move me a little bit, and I remember kind of doing that, but you don't feel anything. And what ends up, they told me we were in there for about 3 hours for one of the procedures, and it felt like we had just gotten started about 10 minutes ago. So yeah, definitely a distortion of time, and you don't really remember feeling anything or talking to anything or anybody during the procedure.
I mean, that's the way you want any procedure to go, especially a 3-hour one. I want to ask you, Dr. Alley, can you explain, first of all, the heart connection to what you do? Because we're here on All Things Heart. We're talking about a blood clot in Steve's leg. So what does vascular interventional radiology have to do with the heart?
Yes, of course. So the way we think about the cardiovascular system is the heart with a network of arteries and veins that run throughout your body. So in medicine, it's common to think of those things all together as part of the overarching cardiovascular system. And particularly in the veins, in this particular case with blood clots, it can if you get blockages and things like that. And clots as well is directly connected to the heart, so that's how it is.
So what did you ultimately decide to do? You get in there, you're performing this procedure. How did you fix Steve?
So in Steve's case, when clot becomes old, it becomes scar tissue and it's hard like concrete. And so in his particular case, he had a long segment of concrete that is a challenge to get through. And so the idea is that you want to get through that scar tissue and that concrete and reconstruct the vein with stents. We're excited to be able to offer that with the technology and the devices that we have now have progressed to where we can actually get through that.
And we have some video that we want to show our viewers as you're talking about this. So how do you get through the concrete? What's the device you use?
So great question. So there are special wires. So you get into a part of the vein that's open above or below the concrete, if you will. And you have to work your way through the little channels in the concrete with special weighted wires. They're kind of heavier on the end and they can help stick through that concrete and poke through and get through.
And where are you going through to get to his clot? Like, where did you go in?
So if you think of it, if you think of the vein like a garden hose, there's a column of concrete in there. So there's a section of that garden hose that doesn't have concrete in it above and below it. So right around his hip below it, there was a section that was open. So I was able to access the vein in that open section and work my way through right from his hip along through that scar tissue to help reconstruct his vein.
Wow. And what's the factor that helps you make the decision to reconstruct his vein rather than try to remove? Do you ever remove the concrete?
So yes, so the concrete is the best way to think about clot. So when it's fresh, which is less than 2 weeks old, it's wet, and you can wash it away, you can dissolve it, you can kind of clear it out of the vein a lot easier. Once it gets old and becomes that scar tissue, it's a lot harder to remove. There are a few devices out there that we can use to try to remove some of that, but the vessel's been damaged enough once there's a scar tissue that you really need to reconstruct the vessel if you can, and so that's how we think about it.
And in Steve's case, his artery was sitting on top of a vein and kind of smushing the vein down.
Exactly right.
Does everybody have an artery that sits on top of a vein, or was that a structural unique thing about Steve?
So we all have that artery on top of the vein in normal anatomic position, but in some particular patients, it will pinch it. So you think of pinching that garden hose again. As the water tries to get through, it can't. So when it backs up, it kind of blows up like a water balloon. And when blood sits like a pond instead of flowing like a river, it'll clot easier. And so that's how that phenomenon happens.
And is one option riskier than the other, or is it strictly a matter of how hard is the clot?
So these are minimally invasive procedures. As we've progressed, so we can make cuts in the skin about the size of a paper cut and kind of work through those.
Wow.
And so those are the types of, with the imaging that we have and the devices that are now available through development of treatment of these procedures, we're able to do it with in a minimally invasive fashion. So.
And Steve, we're going to get to you in 1 second because I do want to know how it felt when you woke up and what it felt like as you developed this clot. But I want to ask Dr. Ali another question first. Is it rare for a clot to form in the leg of a man? We always hear about, well, I always heard when I was younger in my 20s about girlfriends and stuff getting blood clots from the pill in their leg. I knew 3 girls that happened to. I haven't heard of a guy getting a blood clot in the leg. Is it rare?
So in this particular one is where we're talking about the artery pinching the vein is a rarer condition. So it doesn't happen as often. The overall incidence is somewhere, or prevalence is somewhere between 15 and 30%, but we think it's underdiagnosed. So you can get clots in men for various reasons. They're in women. There are lots of predisposing factors to developing clots. This particular reason is a little bit rarer one.
Do you know what caused it? Do you have any theories of what caused the clot in Steve's leg?
So in his case, it was that anatomic pinching. Yeah. So once you can get through there and you can open that pinching up with a stent, it should prevent, hopefully in combination with medications and things like that, should hopefully prevent it from happening.
So it was strictly a structural thing, because we have some people writing in asking, can I get this from flying? Can I get this from sitting too long? Can this happen to me?
In this particular situation, it's an anatomical thing.
Okay.
It's nothing the patients do per se. It just can happen.
It just happens.
Yeah.
It's kind of the luck of the draw. Steve, it would be terrifying for a lot of people to wake up and see that kind of swelling in your leg. If we can put up those pictures again, did this swelling happen overnight, or looking back, are you like, well, I could kind of see over the few days before that it was getting bigger?
So this was an interesting situation, kind of masked under two things. One is I initially had torn my left quad, so that the swelling you see in that leg is my left leg, and it was sort of masked underneath this other sports-related injury I had, where I had tore my lower left quad a few days before that, and my medical team, was just treating that as a normal muscle tear to start with. And then as it progressed in the swelling and some of the pain got more isolated into my groin, that's when my medical team was interested in going to the emergency room and getting it actually scanned to see if it could be related to a blood clot and not just the muscle tear at this point. So yeah, it was pretty jarring to wake up to, especially discoloration, pain, and swelling. Initially just presumed to be part of the quad tear, and then I'm glad that we went and got it looked at in the emergency room, because it turned out to be something that could have been actually life-threatening.
Yeah, we should say the medical team Steve's talking about wasn't here. The first place, you went to a different place for your first treatment of your torn quad, then wound up with Dr. Alley, ultimately, thank goodness. Is it strange to see video of yourself, Steve, undergoing a procedure like this with no memory of it happening?
Yeah, it is a little bit, but Dr. Ali, he's my guy. So I trusted him from the start. The entire team was excellent. So to look back at it, I wouldn't say it's great memories, but I knew that I was in good hands with the whole KU team, and they trained for this their entire life. They're professionals. I felt well looked after, well cared for. Dr. Ali came and talked to me ahead of time and afterwards to explain everything that he was going to do and the team was going to be working on. And so I think it doesn't bring back great memories watching that happen, but it's also the beginning of my treatment and getting back to normal. So I'm grateful for that.
Were you sore immediately after coming to from the procedure?
After, there was sort of a sequence of procedures that I had, and I'd say the one that Dr. Ali was the most successful with at the end of December, that one I woke up with some back pain that they indicated was pretty normal. That lasted about 24 hours, but outside of that, when I woke up, I wouldn't have really been able to tell that there was, doctors in there for 3 hours with wires and catheters and all sorts of stuff.
What was the back pain from?
So when you put those stents in and you reconstruct the vein, when you first put it in, your body reacts with some inflammation around it.
Oh, sure.
So it just takes a second for your body to adjust to those stents, and once the inflammation calms down, it usually goes away within a week. Yep.
So then how long, Steve, until you could get back to your normal activities?
Well, I'd say I'm still a bit restricted just based on the advice of my doctors right now, to still take it easy. There's still some, I'd call it maybe unknowns in terms of how long it takes exactly to heal things that they can't see specifically because they're inside of your body. Right. So I'm still taking it kind of easy, but I was back up and walking, that same day. I walked out of the hospital. It was an outpatient procedure, and, with some care of my wife and kids, just getting me over the weekend back up to normal. I was up and walking and feeling pretty much normal. And then probably over like the next month, continued that progress to back to normalcy.
And so for your continued care, what does that look like?
So right now, like I saw my hematologist yesterday. I'm going to go see Dr. Ali in about a month. And I think what that looks like now is just sort of continued ultrasounds of the area, non-invasive, something they can do topically, to kind of look into the vein and the stent, make sure that it's staying open and that there's no complications, kinking, or clots that are developing around that as the body's sort of adjusting to it.
So are you
still on? Go ahead.
I think you were about to answer my question. Are you still on blood thinners?
Yep. So I'm still taking blood thinners as a precaution to help make sure that, as Dr. Ali's, garden hose analogy, you want to keep everything flowing through there. And the best way to do that is to have the blood anticoagulated, make sure that there's nothing trying to be sticky inside there as your body reacts and heals to it.
Now, Steve, you're in great shape, and Dr. Ali, this guy comes in, clearly an active guy, torn his quad, doing something. Do you recommend any dietary or lifestyle changes for a patient like Steve?
So as he just mentioned, the challenge with especially when you have an extensive reconstruction like this, is the stents themselves can kind of get clogged up again. Oh. So it's really important that you have good follow-up. Steve's very good about keeping his appointments and staying on his medications, and we're fortunate at KU to have a very robust team. So his hematologist is very involved. We're constantly talking to each other. And once the stents you're confident that they're going to stay open, which is usually at a year, that's usually the thing that once they've stayed open that long, you can kind of get back to where you were.
Over the hump?
Over the hump.
Okay,
yeah.
Got it. And then Steve, not to make you look at your legs a lot on the show, but it's so jarring to see the swelling difference as we look at that side-by-side image, your left leg, your right leg. How long of a time was it between you waking up to this and then you winding up in the emergency department somewhere? How long was that?
So this, I guess, when I first injured it and I could tell something was wrong, I think was like a Sunday afternoon. And that next day, 24 hours later, I was laying in the ER. So that overnight period was certainly one that I was paying attention to. I had put some ice on it, kind of did the normal thing for a sports injury, getting it elevated, putting some ice on it, taking some Tylenol, try to rub a little dirt on it, sleep it off, and see how you feel in the morning. And it was clear in the morning that things were getting quite a bit worse and not better. And that's when I started feeling like this might need to get elevated to some medical attention.
And then how long between that first visit to the emergency department and that procedure where we first met you with Dr. Ali? How long of a time frame was that?
That was about 3 months in between there, and so some of that had to deal with just a little bit of what Dr. Ali said about my predisposition or lack thereof to getting a blood clot, and they wanted to try to treat it initially just using some blood thinners, which I think is the normal, less invasive approach, is to try to treat this without having to intervene or have any surgery involved. And so we tried that for a few months just to see if that would start opening up the clot and get the vein back to normal without having to get Dr. Ali involved at all. But after that first couple of months, it was clear to my hematologist that the cement analogy, as Dr. Ali is using, was preventing the blood thinners from having any effect. And that's when we got Dr. Ali involved in interventional radiology.
This is fascinating, and we love getting questions from our community. So I want to open it up to our viewers, because we love when you send our questions. We'll answer them in real time. Well, our doctors will answer them in real time, and so will Steve. You can reach us on YouTube, Facebook, the X platform, or the All Things Heart email. You can connect with us right now through the links on your screen. And we have a question from a viewer named Judy. Judy wants to know, when did the swelling finally go down, Steve?
Yeah, so really once Dr. Ali got involved, it was nearly immediate. And I guess to continue the garden hose analogy, right, you take the obstruction out of the hose and your body knows what to do from there. So once he got the stent in and the clot cleared, there was almost immediate relief. And I'd say over the next couple of days, as your body's clearing a lot of that swelling out, it was nearly immediate.
Becca has a question. Becca wants to know if you could still wear your regular pants. Did you have to switch to sweatpants?
Well, I switched to sweatpants out of convenience, not out of necessity.
Smart.
Yeah, they had me kind of taking it easy for a while, which was helpful, because when I first was diagnosed, it was pretty painful to walk. It was painful to get around. I was using some crutches to kind of help get through my daily tasks. So I never switched pants, but it was nice to when you could wear sweatpants or something that was a little more stretchy to accommodate the swelling, because as you can see in the pictures, if you were wearing, like when I would wear jeans, it was really obvious. It was difficult for me to put my normal size jeans on when my leg was that big.
Jeans are never
that's all back to
comfortable.
normal now.
Right, jeans are never
That's right.
comfortable. Sweatpants are always the more comfy option. Nathan wants to know, Dr. Ali, is it possible that the torn quad could have caused the clot?
So what I suspect is that he had that pinching already, and so he probably had some chronic clot existing in his veins, so that cement. And his body had formed what we call collaterals, new veins that went around it. And just the minor injury itself can cause your body to clot more, and it sort of probably exacerbated it and revealed the underlying condition that needed to be addressed.
Martha Reesley has a comment for Steve. She writes, Steve, you have really nice legs. Dana has a question. Dana wants to know, what's the risk of a blood clot rupturing? Do blood clots ever rupture?
So the main risk with an acute blood clot in your leg is that it can go to your lung and cause, through your heart, and cause a pulmonary embolus that can kill you. So in the primary setting, when that stuff is fresh, that's the main risk that we're concerned about. Following that, when it becomes old, is the leg swelling and something we call post-thrombotic syndrome. So post-thrombus clot syndrome is the syndrome. You have swelling and pain in your leg that can be really life-limiting and can make it a little bit miserable. Eventually, you can start getting ulcers in your leg that can get infected if your swelling gets bad enough. So if you do have something like Steve had, please seek medical attention, and we can get an appropriate workup and help you out, hopefully.
Lauren says, what's an acute clot? Is there acute and then another kind of clot?
Yeah, so there is acute and chronic. So that basically means new and old.
Okay.
And so like we were talking about earlier, when it's new, you like the concrete, you can wash it out and you can kind of get it out of there. But once it becomes old or chronic, it's that scar tissue and it's that hard concrete that we've been referring to.
We have a couple different questions about flying. Marie and then Marjorie both have questions on if Steve can travel, can he fly? Is flying dangerous for him?
So it's sort of patient by patient, and so he can definitely travel. Restrictions on his, in regards to his anticoagulation, his blood thinners, is sort of a working combination with his hematologist and the team. As far as commercial flights and things like that, just remember to get up and walk around for movement to avoid blood clots. You know, maybe walk up and down the aisles and things like that. But more strenuous stuff is on a patient-by-patient basis, and you just kind of have to take it that way, because you really want those stents to stay open. Because if we keep having to go in to reopen them up, it can be a real challenge.
What do you always see these pressure socks advertised?
Yeah.
For people are going to be on long flights. Do you have to wear pressure socks now? Or those, are they called compression garments?
Yeah, so elastic compression stockings. So if you think, let's think of it this way. So if you have that pinching, the garden hose behind it blows up like a water balloon. When the walls get stretched, they can get inflamed, they can hurt, they can swell, what we've been talking about. So when you have those compression stockings, you can think of it like squeezing that water balloon. So it takes the pressure off the sides of the wall, can decrease the inflammation and help the blood flow up your leg.
Do you wear those, Steve?
Dr. Ali had made a recommendation that I start looking into that. I haven't been wearing them right at the moment, but one thing I'd say is that, you know, his advice about traveling and even in the car is I'm definitely more aware and cognizant of doing like heel pumps and kind of calf raises and things to help keep the blood circulating. Even throughout my normal day, if I'm sitting for an extended period of time, I find myself like having a mental alarm clock to get up and do a little bit of walking, or at least keep my legs and my feet a little more active than I had in the past. And that seems to, at least mentally, help make sure that I'm thinking about it more frequently.
Is there any kind of test Steve can get to see if this could happen in his other leg?
So the way the anatomy works, the artery that sits on the vein is predominantly on the left side, the left vein. So we can see his anatomy when you get CAT scans, which he had done. And so we can see if there's another vessel laying on top of that on the right side. However, common things being common, the way the anatomy is, it's predominantly a left-sided thing.
Okay.
Yeah.
So hopefully one and done.
Yeah.
One and done. As we wrap up this discussion, I would love some final thoughts from Steve and from Dr. Allie. Steve, what's the one thing you hope people watching take away from this discussion?
I kind of actually have three quick things to think about. One, some people had told me early in this process that nobody knows your body like you do, and I think that that's really good advice. It would have been pretty easy for me to either try to muscle or tough through this initial quad tear and kind of dismiss something that could have been life-threatening, which is the diagnosis of the clot. And so that advice of, hey, if you think something's wrong or you feel like something's wrong, no one's going to know specifically your body like you will. So trust your instincts, seek medical attention, like Dr. Ali mentioned, at least elevate it out and try to stay off the internet, right? Don't try to self-diagnose and find out what's wrong with you by just trying to do a Google search. Have a professional team look at it. There's other things, looking at deep dive into some of the blood work that they had that can show some underlying things. I do want to say that there's also amazing people that at KU and across the medical profession that spend their entire life dedicated to making sure they know how to take a catheter and snake it in through somebody's vein and make sure that they know how to take care of this, and that's really incredible. And then I'd say my real final thought is really an honest and sincere thank you to Dr. Ali and his team and my hematology team for taking such great care of me and getting me. It's still a work in progress, but for all intents and purposes, I'm back to normal, and that's an amazing feeling. He really gave me a chance at a second life, and I'm grateful and appreciative of that.
Boy, that's nice. Nice to hear. Anything you want to say about Steve as a patient?
Steve is, thank you for all your kind words, and that's what we're here for. We're here to help you out. Steve is a very compliant patient. It is a challenge sometimes. We give advice and people kind of tend to do their own thing, but he listened, he takes our advice to heart, and he does what we ask, and so that really helps out. And again, we're here to help, and we're really happy to help and glad that he's doing much better.
And you always talk about that when we have you on the program. We've had you on this program several times with different cases, and you talk about the teamwork between you and the patient and how they play such an important role in their own recovery.
Yeah, and the other, that is spot on. The other thing I'd like to reemphasize, I think we've talked about before, is the way medicine's advanced so much, and there's lots of different areas of medicine. So there's medical management with the blood thinners, there's procedures you can do. So it's a really great value to have a multidisciplinary approach, which is where medicine is going, and we're so fortunate at KU that we all work very well together. You will get complete comprehensive care at our center with in this case with hematology, vascular intervention radiology, in addition to his emergency room physicians that treated him initially. So that if you have the opportunity to go to a center with a multidisciplinary perspective, I really think it has a great advantage.
It's a team of experts working on you. And speaking of teamwork, and we love sharing the incredible work of all of our doctors here at the health system who save lives. We also love showing you what life looks like for them outside the hospital walls.
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Okay, Dr. Ali, we had to bring this back by popular demand. What are you doing here?
That is the flyboard. So yeah, that was
Miami?
Yeah, down in Miami a few years ago.
Okay, what are you hooked up to for people who aren't familiar with the flyboard?
So that is it's got a hose attached to it.
Okay, there we go.
And that's attached to that wave runner there. And so when they hit the button, it shoots water up the hose there and lifts you out of the water, and you're kind of doing a balancing act on it.
How long did it take you to be able to master that? That looks hard.
Well, I appreciate you saying that I mastered it.
Well,
that's
there is a belly flop coming later on the video.
But yeah, that was my first and last time to do that. I haven't done it since. But
were you sore? Were your quads sore?
Yeah.
Speaking of quads, Steve, we got to see when Steve is back in action. Is that something you'd try?
100%. I was actually waiting for the invitation from Dr. Ali as far as my medical treatment, of course.
Yeah.
You guys can bro out together.
Yeah,
Go to Miami.
We'll have to put it on the list.
That's great. Well, thank you so much for taking time to be with us and for sharing that video. I can't wait to see what you do next that you send us for the next episode.
You bet.
What are you going to do? Do you want to put on one of those jet packs?
Yeah, I'll have to think about
and
it.
And head fly?
Yeah.
All right. Well, thank you. And thanks for being with us today. And thank you to Steve for sharing your journey. We appreciate you taking the time to join us and to our audience as well. Coming up next week on All Things Heart, a new mom goes from spending a morning snuggling with her baby to the emergency department and a stunning diagnosis. You'll see the treatment and the changes she made to her life personally and professionally. That's Thursday at 8 a.m.
Coming up tomorrow on the Morning Medical Update. Robin Love's breast cancer had no FDA-approved treatment. 17 years later, she says access to a clinical trial saved her life. I'm Jessica Lovell on the next Morning Medical Update, how an innovative treatment and a doctor/scientist got Robin from diagnosis to survivorship. Friday at 8.